Welcome to Bone Matters, where we examine questions or topics that matter to you. And today we are talking about something called osteonecrosis of the jaw, or ONJ. Now, it's a rare side effect with some of the osteoporosis drug treatments. And you might be thinking, well, why are we doing a whole session on something if it's so rare? And that's because we do get asked a lot of questions. And we know also there are some misunderstandings out there, which we hope to try and sort out. We also know that sometimes these concerns about ONJ mean people don't even feel comfortable starting or continuing with their osteoporosis medication, so are missing out on the benefits. And there also are concerns relating to dental care, and that's what we're going to be focusing on today. It might be useful just to add that actually sometimes there are misunderstandings even among dentists who maybe won't be so comfortable taking out a tooth because of this concern about ONJ. But we hope this discussion is going to generally increase understanding, reduce your risks of ONJ with some simple dental care, but really reduce unnecessary concerns so you can take your medication for osteoporosis with confidence, but also get the dental care that you need. So I am delighted to welcome experts in the field to discuss this topic with me today. We've got Emma Clark, who's a consultant rheumatologist and also a professor at Bristol University. And we've got Lorna Hollingsworth, she's a dentist with a special interest in the topic, and she works in Somerset and Dorset. So welcome to you both. Let's start by asking you, Lorna, just to explain what is osteonecrosis of the jaw in relation to these osteoporosis drug treatments.
Thanks, Sarah. So ONJ is a condition where there is an unhealed area in the mouth, usually after an invasive dental treatment, such as an extraction, which is where we take out a tooth, or where we place a dental implant. And the delayed healing inside the mouth means that the jawbone stays exposed instead of healing up in its normal way. And taking some osteoporosis drug treatment seems to increase the chance of this happening. However, ONJ can also happen without a dental procedure or a related drug treatment, and usually because of some underlying other medical condition.
Perhaps you could just take that on a bit further and just take us through which osteoporosis drug treatments is this related to?
So I think it occasionally occurs with bisphosphonate medications, and these are the most common osteoporosis medications. And so many people take the tablet forms like alendronic acid or risedronate, and it can occasionally occur with these medications. But it can also occur with zoledronic acid, which is the infusion form of bisphosphonate, but also some of our other medications for osteoporosis, such as denosumab, which is injectable medication, and romosozumab, which is also injectable. But I really want to point out that most cases of this jawbone problem, osteonecrosis of the jaw, have occurred when people are taking these same medications, but in very much higher doses than we use in the osteoporosis world. For example, when it's being used as part of the treatment for cancer, not when it's used for osteoporosis.
Thank you. Now, Lorna, people ask, how do I know if I've got ONJ? You know, I've had my tooth out, maybe there is a bit of a problem, maybe it could be an infection. How do I know it's ONJ?
Well, we usually start to think about ONJ where there's been delayed healing and persistence of signs and symptoms around 8 weeks after an extraction. So that's a good starting place to think about whether this could be ONJ. Dental infections after routine dental extractions do normally start to heal within 1 to 2 weeks.
And people think of ONJ as a very serious condition, which obviously it can be. But the question people ask is, well, does it get better? Is this does this mean I'm going to be left with this unhealed area forever? I mean, what's the normal pattern of recovery?
Yes, of course, it could be a concern. So generally, ONJ does get better. It does depend on the signs and symptoms and underlying conditions of the patient. So it can be quite a personalised journey for the healing. Usually where there is ONJ, the management will be overseen by a specialist dental team. And in the more simple cases, which is generally what happens, there may be some monitoring of the lesion, perhaps some prescriptions of antibiotics, or antibacterial mouthwashes. And in the rare but more severe cases, this may require a surgical intervention and a little longer to heal over.
Okay, thank you. Another really important question, which is about what is the chance of this happening? Because we hear quite a lot about it, a lot of coverage sometimes in the media or online, but what is your chance of getting ONJ when you're on a drug treatment? Maybe, Emma, you could cover that.
Yeah, thanks, Sarah. It's really rare, and in fact it's so rare we can't accurately give a number, but we think the chance of it is somewhere between 1 in 1,000 to 1 in 10,000 when you are on an oral treatment for osteoporosis, so an oral bisphosphonate. So what that means is of 1,000 people who take alendronic acid, perhaps one person will get osteonecrosis of the jaw. There is evidence of higher risks than this if you are on those very high doses of the bisphosphonates for treating cancer that I talked about earlier. But remember, most people are put on a bisphosphonate because they've got a really high chance of breaking a bone. So, for example, a 25% chance, a 1 in 4 chance of breaking a bone over the next 10 years. That is really high, and that is the reason why the bisphosphonates are being prescribed. And the benefits of the bisphosphonate in reducing that chance of fracture is far, far outweighed by the really rare risk, 1 in 1,000 of osteonecrosis of the jaw.
Thank you. Now, this is a low risk range that you've described, which is great. There are going to be some people who perhaps are more towards the higher end of that range. And who are they likely to be?
Yeah, we're not, we can't say definitely, but we know that there are some predisposing factors. And for example, poor dental or mouth health, people who have active cancer, and people taking steroid tablets, so glucocorticoids, for another condition, and those predispose you to having a higher chance of getting osteonecrosis of the jaw.
Emma, can I ask you, are the drugs that are given by injection or via a drip, so straight into the vein, that's like zoledronate, are they going to cause a higher risk of ONJ than tablets like alendronate?
Well, certainly we know that when zoledronic acid's given as an infusion or denosumab given as the injection for cancer treatments, where their dose, the actual dose is much higher, that is associated with an increased risk of osteonecrosis of the jaw. But when we look at the doses for osteoporosis, the guidelines are not completely clear. There is some research that has shown a slightly higher chance for zoledronic acid or denosumab or romosozumab, so the injectable medications, and osteonecrosis of the jaw, compared to oral tablets, alendronic acid, but not all of the evidence. And again, even if there is a slightly increased risk of osteonecrosis of the jaw with the injectable or infusion medications for osteoporosis, the benefits of those medications in reducing the chance of hip fracture is far outweighed by the very rare risk of osteonecrosis of the jaw.
Thank you. And so that's talking about the route you're taking the drug by. What about the length of time you've taken it for? Are the risks going to go up the more of that drug you've had over time?
We think so, yes. The guidelines say that if you've been taking it for more than 5 years, the risk or chance of getting osteonecrosis of the jaw related to a dental extraction is higher. But again, I just want to emphasize it's still really rare. And even if you've been on your medication for 10 years, the benefits of the medication are likely to far outweigh the risk of this rare side effect.
Now, let's move on to dental health, because I think that's our focus today. People hear a lot about this when they go for their medications. It's discussed quite rightly with their healthcare professional. So perhaps, Lorna, you could tell us a little bit, why are you asked about your dental health and what do we mean by that?
Thanks. Yeah, so it's important that we all have good dental health, but in particular, when you start to take the bisphosphonates, we just want to make sure the mouth is as stable as it can be before we start the treatments. We want to try and reduce the likelihood of anybody having extraction anyway. Nobody wants a patient to have an extraction, but with those patients taking bisphosphonates, a dentist will be wanting to make sure that we avoid extractions where we need to, although shouldn't be worried if we have to take the route of having an extraction.
And what about a dental appointment? There's quite a lot of discussion about that. Why are you asked to have why might it be suggested that you'd have a dental appointment before you start your treatment?
Yes, I mean, it's a good idea to have a dental appointment. It's not essential, particularly for the bisphosphonates for osteoporosis, but it just makes sure that your dental health is as good as it can be, or at least stabilised, so you're not likely to need an extraction in the near future.
So what we're hearing is that good dental health will reduce your risk of ONJ, make it even lower. And perhaps it would be helpful, Lorna, if you could just explain, what does good dental health mean?
Sure. So we would be looking to advise all our patients to be brushing their teeth twice a day, ideally with a fluoride toothpaste. Perhaps also supplementing that with a fluoride mouthwash to be used at a different time during the day. Ideally, they should be brushing between their teeth, either using some floss or interdental brushes. We'd also be looking for people that also wear maybe a partial denture to take that out, ensure that's cleaned. Ideally, again, leaving that out overnight, although understandably not everybody wants to do that overnight, but they should certainly make sure the denture is very clean and the mouth is very clean before the denture is reinserted in the mouth. And we would be looking for patients to keep within safe drinking limits with alcohol. The recommended is for males and females, no more than 14 units of alcohol per week, and also to stop smoking. So smoking cessation, very important for all patients, regardless of whether you're taking bisphosphonates or not.
It's really helpful, because I think often we don't know what dental health means. So that's been really useful. So back to the question about ONJ and dental checks. Emma, can I just ask, is it always necessary to see a dentist before you start one of these treatments?
Yeah, thank you. I think it's a really important question. I do not think it is necessary for every single patient to see a dentist before they're started on a medication for osteoporosis. I think it's really important for those people who are not getting regular checkups, for example, but if people have good dental health and look after their teeth, there's no need for them to have an additional appointment before going on an oral bisphosphonate, for example. But there are people who are in the higher risk groups, particularly if they're taking these medications in the high doses for cancer treatments, so they've already got one of the other predisposing factors such as cancer. And if they're also on steroid tablets, for example, they would be in a high risk group. And it would be sensible for them to have a dental appointment. But for most people, the vast majority who are going to go on tablet bisphosphonates, we don't want to delay people starting those medications because they have a high chance of breaking their bones today. And so we want them to get onto the oral bisphosphonate tablets as soon as possible, and they do not need to delay to see a dentist.
Lorna, can I ask a question that we get we regularly get asked, which is, can you have a tooth out if you're taking one of these osteoporosis drug treatments linked to ONJ?
Sure, yes. I mean, your dentist will assess your situation. Every patient is different and every extraction is different. And the dentist may offer alternative treatments to minimise the likelihood of having an extraction. But where that's not possible, yes, the patient can absolutely go ahead and have a dental extraction. Normally that patient, it would be reviewed by the dentist around 8 weeks after the extraction, just to make sure that rare presentation of ONJ isn't present. However, for patients in a slightly higher risk group, depending on the complexity as well of the extraction and any other patient factors, any other medical conditions, the dentist may go on to refer the patient to a specialist unit who can look after the patient for that particular intervention.
Perhaps you could talk a little bit about why we hear that some dentists do seem very reluctant to do an extraction when someone's on these treatments.
Sure, and dentists want to look after their patients. They want the patients to have a good outcome. That's why we're all here, and we all aim to do no harm for our patients. So we might be concerned that if we removed a tooth for a patient, that rare presentation of ONJ may occur, and we would be concerned about the impact for the patient and perhaps some impact for their own personal practice. So dentists may be reluctant to an extracting a tooth, but for most cases, most of the time, for people taking bisphosphonates for osteoporosis, it should be a straightforward procedure.
Lorna, can I ask you just to explain a little more about what invasive dental treatment means? Because we hear that it may be linked to ONJ. So what is an invasive dental treatment?
Sure. So in the context of this conversation around bisphosphonates and osteoporosis, invasive dental treatment is around removing a tooth or an extraction or the placement of a dental implant to replace a missing tooth.
And a root canal treatment, how is that different?
A root canal treatment, the intention there is to preserve a tooth, so not to extract, and that's where the pulp or the nerve of the tooth is removed to preserve the root and enable a dentist to build up the top of the tooth so you have a fully functioning tooth again.
So that's not invasive in the same way you're saying as an extraction or an implant?
Not in the same way as an extraction, no.
So can you have an implant if you're on these drugs? That's the second question we get asked. You've talked quite a bit about an extraction. What about an implant?
You can have a dental implant. Your dentist would need to assess your suitability generally for an implant. And again, for bisphosphonates and osteoporosis, it is fine to go ahead with an implant. To reduce the risk completely, though, you would not need to go ahead with an implant, so not to have the implant, and that becomes really a personal choice between yourself and the dentist, and you need to make that decision together, although a dentist will have the lead in that decision-making process.
Do you want to add anything there at all? Because I think this discussion is quite difficult sometimes with people trying to understand that if it's a low risk, why will the dentist not go ahead with it? Is that something that you get asked?
Yes, definitely. We see a lot of concerns from patients and reflecting their dentist's concerns, and I think a root canal or an implant particularly is probably what we would call planned care. So that's something that would be thought about and planned to have within the mouth. It's not an emergency situation, and generally if you need to have an emergency dental extraction, you must have that if you need it. But as Lorna has pointed out, we should all think about trying to prevent that, obviously. Routine planned care is a decision about whether you want to have that or not. It's almost impossible to be able to give people accurate information on the exact chance of, am I going to get osteonecrosis of the jaw if I have a dental implant, because the numbers are really so small. So generally what we say is the risk is low, but do you really need this procedure?
So perhaps to say that from a dentist's point of view, as you said, Lorna, they want to avoid any possible risk. And if it's what they may see as cosmetic, then it's the choice of the dentist whether to do that or not. But it doesn't necessarily, if they say no, it's not because it's a high risk. It's just that they're choosing not to do that procedure. Because I think people feel if the dentist says no, that means it's a really high risk, and it's not quite that simple, is it?
No, it's not that simple. I think the dentist just wants to ensure for planned elective care that risks are completely reduced, and you can mitigate completely by not providing that implant. That might be a way forward that dentist wants to take your care.
Yeah, thank you. Another question is, do you need special care, antibiotics, for instance, or going into hospital if you have an extraction or an implant when you're on one of the drug treatments for osteoporosis?
Absolutely not, no. You may need antibiotic cover for other medical conditions, but with regards to bisphosphonates and osteoporosis, taking antibiotics before the procedure or just after the procedure is not indicated.
Emma, perhaps you could talk a little bit about stopping treatments. Now, people say to us, should I stop my bisphosphonate before I have my tooth out? Is that going to reduce the risk of ONJ?
Yeah, thanks, Sarah. No, it won't. There's really no point temporarily pausing your bisphosphonate because it takes many months to years to come out of the body. There are some things you can do though, and perhaps timing of the dental treatment, particularly if you're having something like the annual infusion, for example. And generally we might want to say don't have planned work around the time of the infusion and wait until your mouth has healed to be on the safe side, for example. But one thing I would also say is if patients or if dentists are worried or concerned, they can always contact their local osteoporosis specialist. I get contacted perhaps every few weeks by a dentist just asking for clarification about our thoughts about doing dental work while somebody is on a bisphosphonate medication, and we can provide bespoke information relevant to that individual, but also signpost the dentist to the national guidelines.
Thank you. I think that's a really helpful pointer. So one final question relating to ONJ. People ask, why should they be reporting loose teeth? It's something that's sometimes mentioned on their information sheet. So Lorna, perhaps you could explain a bit about why is there that suggestion on your advice sheet?
So it's important that anybody with a loose tooth does seek advice from their dentist, and they can identify the problem with the tooth, but it's unlikely to be a ONJ in its initial presentation.
Now, just to finish off, I've got a few general questions relating to dentists, dental health and osteoporosis. Can I just ask you, Emma, is tooth loss a sign of osteoporosis? People also ask, is it a side effect of the osteoporosis drugs?
Yeah, thank you, Sarah. So osteoporosis does not cause your teeth to fall out, and the bisphosphonate medications do not cause your teeth to fall out. Having said that, there is a link between periodontal disease and a general risk of osteoporosis. And as we've heard earlier, periodontal disease is a cause that is a cause of your teeth becoming loose and falling out. So I think it's that rather than osteoporosis causing the tooth loss.
A little bit. We do also get asked, when your dentist talks about bone loss in your, on a dental x-ray, for instance, is this osteoporosis? Lorna, perhaps you could comment on that.
No, this isn't osteoporosis. The bone loss your dentist will be talking about is the localized loss of bone around a tooth, and that in itself is usually due to a periodontal disease. And as Emma has just said, there may be some link between periodontal disease and osteoporosis.
Thank you. And another question for you, Emma. Can you break your jaw with osteoporosis? People worry if they are having quite intense treatment, is there some risk to breaking their jaw?
So jaw bones don't break with osteoporosis, and particularly about this webinar today, if you're taking an oral bisphosphonate, it will reduce your risk of breaking bones. That's the whole point of taking it.
Great. Well, I think we've covered an awful lot today. Thank you so much. Perhaps I could offer you both the chance for any kind of final message that you'd like to give to our listeners. Lorna, perhaps you could go first.
Thanks, Sarah. I think the message I'd like to leave the listeners with is taking bisphosphonates should not prevent you from receiving the dental care that you need. And receiving dental care is a sensible approach to keeping well generally, and also reducing your risk of ONJ.
And Emma, anything you'd like to add?
Yes, thank you. What I would say is if your dentist is reluctant to do a dental extraction or a treatment that you need, do suggest to them that they contact their local osteoporosis specialist. We're really keen to ensure everybody gets the care they need, and we're very happy to give advice.
Thank you. Well, I hope you've all found this discussion useful. You need to make your own decisions about osteoporosis drug treatments, but you need to be well informed. And I hope this conversation has been really useful and makes you feel more confident. And I'd like to thank our speakers today and to thank you for listening. There are more information. There's information below about other Royal Osteoporosis Society resources and information that you can find helpful.